Hi, everyone. Thank you for coming this afternoon. This is our second panel. It is COVID-19 in Athens, Georgia. We're really excited. We hope we learn a lot today again. I'm Jessica. I'm a Master's of Public Health student at UGA, concentrating in policy and management. I'll be helping facilitate the discussion. We also have Anisha Koshi, who is also an MPH student concentrating in policy and management, and also MHA, and she'll be moderating our comment section today. And then we have Dr. Bagwell Adams speaking with us today. She works on the Athens Wellbeing Project and other cool stuff. I'll let her briefly introduce herself before we get started.
Good afternoon, everybody. I'm Grace Bagwell Adams. I'm on faculty in the Department of Health Policy and Management, an associate professor there, and also relatively new assistant dean for outreach, engagement, and equity in the College of Public Health at UGA.
All right, thank you, Dr. Adams. So I'm going to get started by sharing the most recent COVID numbers, and then we'll get going on the discussion and panel portion of everything. Feel free to ask questions throughout. You can use the chat. As I said, Anisha will be moderating that for us. And yeah, we'll have some good discussion. So starting with COVID statistics, we'll start globally with the World Health Organization. There's 27,486,960 confirmed cases globally, and then 894,983 deaths. Then moving to the United States for the CDC, and these are all updated September 9th, by the way, so yesterday. We have 6,310,663 total cases, 189,147 total deaths. And then they weren't sharing this last time I checked, but 2 weeks ago, last time I did the panel, but they have the last 7 days, so there's 262,971 new cases in the last 7 days. And then Athens Clarke County, which I pull from the acc.gov site, has 4,109 total confirmed cases. And that's about 700 increase in case since Friday, September 4th, so last Friday. And then there's 35 total deaths in Athens, which is a 3+ increase since Friday, September 4th. I want to note for Athens, just to think about, UJ orientation was August 17th. On August 17th, there were 2,264 confirmed cases and 21 deaths. So in less than a month, we've added 1,845 cases and 14 deaths in Athens Clarke County. But moving on from that, I'll let Dr. Adams take over and introduce the Athens Wellbeing Project and work she's been doing in the Athens community throughout this process. And then we'll open it up for questions.
Yeah, Jessica, I could talk for an hour about really anything related to AWP in my work. So tell me about how much time you want me to spend on the intro and how much we want to leave for questions.
Let's see, maybe like 20 to 30 minutes on the intro and then the other half for questions. I think there'll probably be a lot. I know I'm really interested in seeing how you've applied it to COVID-19.
Sure.
But yeah, I know a lot of people have probably had class and a lot haven't. So
Sure. Yeah, well, I'm going to put the link, it's right there in the chat window, to our website, so feel free, anybody that wants to take a look at it. And specifically, we have actually built out a sub-page that's for COVID-19 related data that we house and update there. We've got to update it. It hasn't been updated since the return to campus, that particular portion of the COVID-19 website. But yeah, feel free to use that as a resource. So let me give you an overview just of AWP and then Athens Wellbeing Project, and then I'll talk a little bit about the way the data have been used since the pandemic has occurred and the way that we continue to plan, not just for using AWP data, but integrating the best information that we have to inform policy development in Clarke County. So Athens Wellbeing Project officially began in 2016. We are in the sort of 5th operating year of that project. I always like to tell people from the get-go that it wouldn't be possible without the Athens Area Community Foundation, which is an incredible asset to our community. So they handle and are really the leadership and the heart of philanthropic activity in Athens Clarke County and the surrounding counties. Sarah McKinney is the president there, and the Athens Wellbeing Project is championed by the Community Foundation. It's hard for people to wrap their head around AWP at first because it's not an organization unto itself. We are not a nonprofit. We are not our own standalone 501c3. We are a collaboration. I think of AWP as a roundtable in some sense. It is, again, not its own organization. It's not owned by anyone. And in fact, the research team behind AWP, which is led by myself and includes Amanda Abraham and Spia, Jerry Shannon in Franklin College of Arts and Sciences, and Celia, who is our sampling expert, Celia Eicheldinger, who works for RTI International. The way that we think about, the research team thinks about AWP is that we're really creating a public good. So we're creating something that is really accessible for the community in general. And it's really the first effort of its kind in Clark County. And it's interesting because I spent a lot of time, and my grad students that have worked for me on AWP spent a lot of time looking at communities across the country to see what other communities are doing around measuring well-being and tracking data and collaborating to share those data to inform policy. And I haven't been able to find anything exactly like AWP in any other place in the country. So we are, in some sense, blazing our own trail, but it has been a real learning experience, and I think that we are at the point where we can say with some level of confidence that it's been a real asset and a resource for our community, especially in terms of planning purposes. And we've seen the data, I think, used more than ever in COVID response and designing a response to some of the specific economic fallout that we're seeing from the recession as a result of the pandemic. So I'll talk a little bit more about that in a second. Yeah. Is there somebody have a question? I don't know, somebody sneezed. It's hard to tell if it was a sneeze or a question or a comment. Feel free to type it in the chat window if so. So Athens Wellbeing Project is championed by the Community Foundation, but we have many institutional stakeholders and partners. You can see that on our website. That's one of the unique things about it, that at the institution level, we've got both hospital systems, St. Mary's and Piedmont Athens Regional. We've got our Community Foundation. We have Athens Clark County Local Unified Government, which includes the police department and all of the other departments that's under the umbrella of the local government. We work with Clark County School District, the United Way of Northeast Georgia, Family Connections Communities and Schools, and the Athens Housing Authority. And so we have a really, a pretty broad representation of all the major institutions in our community in terms of buying into the project, and that's both paying for the actual project to happen and then investing in using the data to inform decision-making and policy. It started out with a household level survey that is truly relying on I think if somebody could mute their mic, there we go. Okay. So it started out as a household survey that was really built on for all my public health people on the call, built on a social determinants of health model. So I'm gonna kind of make this discussion a little bit like I'm teaching a class and ask for any one of the folks on the call to pipe in and say, what does it mean? What do I mean when I say social determinants of health? Y'all didn't know you were coming to class today. And there are faculty members here. You can answer too. You're not precluded. I see you, Justin. Social determinants of health. Anyone?
So social determinants of health would just be kind of the things in your life that have will guide your health outcomes, things like your education, where you live. I think in Dr. Lloyd's class, he's said multiple times this semester, like your zip code is one of the most important things that determine your health. So it's all those kind of factors that impact your health and other aspects of your life too, your education, everything.
Yeah, absolutely. Thank you, Jessica. Being a great PHA president over here and jumping in. Yeah, I mean, it's just this idea that our health outcomes and the indicators that we typically look at, it's really not just about the clinical outcomes, right? It's our health is a function of so many other things, not just the place we live, but the air we breathe and the water that we drink and the income that is brought in to the household and even other demographic characteristics. You know, it's really interesting because for a long time, communities have collected data and tried to assess well-being and they've tried to assess health. And every community across the country, most communities in the world are doing this. They're collecting data Sometimes it's informal, most of the time it's pretty formal. But for a long time, the measurement of health was really restricted to just those indicators about health and well-being, right? So um, what does our hospital utilization look like? What does our life expectancy look like? But the social determinants of health model is really about making sure that we collect data on many other aspects of life. And so Athens Wellbeing Project is really founded on this idea of, if we want to measure health and well-being in a community, we've really got to look beyond the typical indicators that are used in a community health assessment. And so we collect data across 5 domains of life. That includes health, housing, community safety, education, and civic vitality. Civic vitality are the really critical things like political participation, belonging to a faith community, social capital measures, things like how often do you get to see friends and family outside of your regular work routine. And so we got really creative with our stakeholders and with our research team in 2016 when we started and said, where are the gaps in the data? What do we not know about our community that we really need to know to be able to improve health and well-being? And how can we measure this in a really comprehensive way using the social determinants of health approach? And that's how we came up with those 5 domains. There's lots more on the website about the way that we collect the data and the domains themselves, and even the survey instruments. I won't bore you with any of that. I'm not going to present really any statistics to you. I think the punchline is that the project is meant to be a complement to the other data collection that goes on in the community. Every single one of the institutions that I mentioned have local, state, and federal requirements for data collection and reporting in order to remain accredited and in order to receive funding, especially from state and federal agencies. And so this project was really meant to be, again, a public good, something that we were creating for the community, and something that we have engaged pretty deeply and widely with the community in figuring out not just what data we need to collect, but how to collect those data. Athens Wellbeing Project is really possible because of the community partners, and we've got lots of students on the call because of the students at the University of Georgia who serve on as volunteers on data collection teams. We collect the data. We've been out in the field twice now, once in 2016, once in 2018, into the winter of 2019. Both of those times, the way the data have been collected, we've given families an option to do the survey online, but we all know that that can exclude vulnerable groups and families for many different kinds of reasons that might not have access to the internet or might not want to do a survey online. And so we've engaged with community partners and students at the University of Georgia to go door to door and help collect those data. And in particular, we partner with a program that is run out of Family Connection Communities and Schools and is now funded by our Athens-Clarke County Government Commission, Mayor Commission, which is called the Neighborhood Leader Program. And so we had 20 individuals who are lifetime residents of Athens-Clarke County, who have raised their families here, who've worked here, lived here for a long time. They know more about this community than most people. And so we had those individuals lead the data collection teams door to door. And so that aspect of community engagement and partnership is really the reason that we were able to get the level of representation that we have been from people completing the survey. So we have 2 points in time now. We have over 2,400 households in the sample, and the data are really used routinely by all the stakeholders that I've mentioned to kind of guide policy. I'm going to go into just a couple examples of what that has looked like specifically pre-COVID and post-COVID. And then, Jessica, I think we can open it up for questions if that's okay. So pre-COVID, some examples of how the data have been used. I would say that if you look at our hospital systems, both hospitals are nonprofits. They're required to conduct community health needs assessments in order to retain their nonprofit status. Athens Wellbeing Project checked that box for them, but more importantly, the data from Athens Wellbeing Project, particularly on health disparities and measures around food insecurity, helped design their implementation, helped really inform their implementation plan. And in particular, for example, St. Mary's had a mobile food truck where they were delivering fresh produce around Athens-Clarke County. And it turned out that the places that mobile delivery service was going was not matching up with what Athens Wellbeing Project told us about where food insecurity was most intense in the community. And so that's one specific example. We use the Athens Wellbeing Project data at the sub-county level down to the community level to help really redesign the delivery route in the places where St. Mary's fresh food delivery service was going in the community. I'm trying to think through each one of our stakeholders. Clark County School District, we have been partnering with them and their local school governance teams. We have a charter district now in Clark County School District. Pre-COVID, we were presenting the data at the neighborhood elementary school attendance zone level, and those data have been made available as a resource for the local school governance teams to guide their policy making and their policy decisions. Pre-COVID, we also had an economic prosperity package passed by the Mayor and Commission. You may see my daughter pop in the frame in just a second. Thank you, Bonnie. Bonnie, would you like to say hello? We have no childcare for 2 weeks, so this could get interesting today. Sorry, y'all. Where was I? Yes, economic prosperity package. Much of the data has been used and presented to Mayor and Commission and to the local government county manager's office to really understand what some of the health disparities and social disparities are in the county, and to inform some of the work that the Mayor and Commission has done pre-COVID to talk about what the prosperity package might do, and post-COVID to actually design that has become an economic relief package because of the fallout and all of the unemployment and the increase in poverty in the county. And so post-COVID, a lot of what we have been doing is really trying to dig in and use the indicators that we have to inform the response, the emergency and relief response. In particular, the Community Foundation actually collected a few $100,000 that has been distributed to nonprofits across the community to meet some of the most immediate and pressing needs that have been created by the pandemic or exacerbated by the pandemic. And so the data have been routinely used to inform those emergency relief responses. And we also use these data. I sit on the Get Comfortable advisory group for Creature Conference, which also allocates a few $100,000 a year to meeting the most pressing needs of Athens Clarke County. So how do we use the data to try to drill down and say, among the most vulnerable in Clarke County, here are the real challenges that we observe across these 5 domains that I've presented to you. So that's really the 10,000 foot view. I'm happy to take really more specific questions or COVID related questions. Happy to take questions that have nothing to do with Athens Wellbeing Project. There's plenty of work that's been going on with the College of Public Health in the Athens community a little bit more broadly. But I'll just open it up now. Thanks, Jessica.
Thank you. We have a couple questions from the Google form that I'd like to start with that were asked previously. So someone asked, can you speak a little bit on how environmental injustice and racial injustice factors might be impacting the Athens community specifically? We touched on this a little bit with talking about social determinants, I feel like.
Yeah, Jessica, is that question specific to post-COVID?
I'm going to say yes. I'm not totally sure. If you're on the call, Laura, you can say if you meant specifically post-COVID. She might not be here, but I'm going to say post-COVID probably.
Yeah, I mean, there's no doubt that we're in the midst of 2 crises, right? We're in a global pandemic, but we also are in the middle of this social and racial injustice crisis nationally, statewide, and I would argue locally as well. It's interesting because it's now getting the national and local attention that it deserves, but it's been ongoing for a long time, right? And, you know, undoubtedly, whenever you have a crisis, especially one like a pandemic, it disproportionately affects the poor. It disproportionately affects the people who have systematically been excluded from a system. And so I think in Athens, I've been very worried about the community with the pandemic because we were already in a very precarious situation beforehand, given the fact that, you know, over a third of our families lived in poverty, below the federal poverty line. Almost 20% of our families didn't have access to health care insurance. We have lots of housing issues, access to affordable housing, access to quality housing. All of those things were present in Athens Clarke County before the pandemic, and we have measured them, and we have, you know, written about them and reported on them through Athens Wellbeing Project. And certainly it's been measured and reported and discussed in other circles completely separate from Athens Wellbeing Project in Athens Clarke County. And so we've known these things for a long time. The question becomes, what happens when you have a global crisis like the pandemic, what happens to the most vulnerable among us, and what happens to some of those systemic injustices. And what happens is that they're exacerbated, and folks who were struggling before are struggling even more now, especially when you consider that a lot of the hourly wage work, that's employment that has just disappeared overnight, and especially in the service sector and the service economy, which we rely heavily on in Athens, Clarke County. And so what does that mean? Well, many African Americans in our community have those hourly wage jobs, and they're working multiple hourly wage jobs to make ends meet. When those jobs disappear and they don't have their jobs anymore, then they have no income. And then when we have the federal government cutting unemployment benefits, through the end of July, we had a little bit more of a safety net, but a lot of those benefits have just evaporated. And so my concern now, as we move into the fall, as we move into flu season, the pandemic kicks up again, and we have the return to campus with many more cases. The concern is, of course, that those employment opportunities are not just magically reappearing, and that as you have longer and longer spells of unemployment and lack of access to health care, that all of the things, it's kind of a domino effect, all of the things that we worry about for the health and well-being for our entire community, and particularly for low-income families and for minority families, that all of those issues are exacerbated, and they're worse. We haven't gone into the field with Athens Wellbeing Project in post-COVID. The reason is because we're not competing with the census this year. Anybody and everybody on this call, if you haven't done your census, you've still got time. But the point is that we still have indicators, lots of indicators, that things are worse than they were before COVID in terms of the economic vulnerability and of many of the families in our community. And so it's something I'm very worried about.
All right, thank you for that, Dr. Adams. The next question was, will it be possible for Athens and UGA community to reduce transmission so that students in Clarke County school districts have an opportunity to begin face-to-face instruction anytime this school year? And what can we do to accomplish this?
That is $1 trillion question. On our current course, absolutely not. I mean, the University of Georgia at this juncture, we have a case explosion. We are one of the top 5 hotspots in the nation right now. There is no indication that we are going to move online. There's no indication that we're going to send students home from the University of Georgia at this time. Of course, that is a decision that is made by the university system in Georgia. But in terms of the effect on the school district, do I think we're going to have an opportunity to have face-to-face instruction anytime this school year? Definitely not this calendar year. I really don't see this trend reversing anytime soon. I wish that I could give you better news or give you a different opinion, but I'm just, that's really the truth and the direction of this disease, the way the disease transmits. The decisions that we've made about testing, tracing, isolation at the university, the constraints that we have in the healthcare system and the testing system locally in Clarke County, all of these are factors that really contribute to the explosion, the exponential growth in cases within the UGA community. And the truth is, as we all know, is that the University of Georgia doesn't live on an island unto itself. It's embedded in Athens, Clarke County. And so the question is really important. I know we've got folks on this call with children in the Clarke County School District system. I just was on the phone with Amy Rourke right before this call, texting with her. And I'm in close collaboration and connection with Clarke County School District, with many partners in the district. And I deeply empathize with the decisions that they're having to make, and with the fact that we have thousands of children who are having to do virtual learning right now, and that has severe implications, especially for our low-income families, and for folks who struggle. I think all families with school-age children are struggling right now, don't get me wrong, but I think especially for those who have issues with having childcare access, or even internet access. There are pockets of places in the county that don't have reliable internet access. It's a real problem. It's a real problem. And I don't see us being able, the Clarke County, the board, or the group of folks that's making decisions around when it is safe to come back have established some metrics about what that could look like. And we're just nowhere near. I mean, we're moving exponentially in the opposite direction of the direction that we would have to go in order to meet the criteria for returning to safe face-to-face instruction in Clarke County right now for Clarke County School District. And I don't see that changing anytime soon, not unless some reality changes with how the University of Georgia cases are being handled.
All right, thank you for that, Dr. Adams. And then with that, I'm going to open up the chat question. Anisha, do you want to take the first question from the chat and read it out?
Yes, we just got one. So from Anne, is there formal or informal involvement of UGA faculty with expertise outside public health in the strict sense?
And can you tell me a little bit more about what you mean? You're on mute, Anne. Can you unmute your microphone?
The wrong thing. Okay. The university is a resource of information on economics and in the public policy and all kinds of things like that that might on an ad hoc basis be useful for what you're bringing to bear. And I'm thinking particularly about people in infectious disease or really the sort of biological infectious aspects of the COVID situation, but also things that would spread outside of that, like nutrition people in the context of the homeless and so forth. And mostly this question comes from a curiosity about how UGA can get involved generally in activities in the community instead of having this sort of, we're all here on the campus kind of perspective. It's almost as if I'm thinking about it as your program could be a very useful outreach to the university to kind of like get it a little bit more woke than it is.
Yeah, I appreciate that question and the comment, Anne. And I should say, in all fairness, that the University of Georgia is an institutional partner in Athens Wellbeing Project, and I have presented many times across departments and schools and institutions and areas of the university to let people know about Athens Wellbeing Project. What are our findings? How is this an asset both to the community and to the University of Georgia in general? And I do see it as a really powerful tool to improve the town-gown relationship and to use your verbiage to get everybody involved a little bit more woke about all this, right? So I think you're right. And I am hopeful that it can and has been doing that. And I'll also say that there are so many faculty members across the University of Georgia's campus that are deeply engaged in community work and community engagement work. We have an Office of Service Learning that's led by Dr. Shannon Wilder. It's just incredible. They run Campus Kitchen. I mean, weekly we've got students involved in preparing, procuring food, preparing the food, distributing the food to people who are food insecure across this community. And that's completely made possible and by the Office of Service Learning in the University of Georgia, and also the U Garden, which actually contributes produce to that particular enterprise. So that's just one specific example, but we have lots of incredible faculty members who have been deeply engaged for a long time, much longer than I have, in lending their expertise in research to try to leverage that into the community, whether it's Athens Clark or other communities across the state of Georgia. So I don't want to give short shrift to the fact that we have, I think, a lot of faculty who have the heart of what it means to be a land grant institution, which means, giving back to the state that has given us the ability to even have the University of Georgia in the first place. And so I'm really proud, of those faculty members and really grateful that we have so many leaders on campus who are doing that work. I think that those are the unsung heroes and some of the stories that you don't hear as often as we probably could. In particular, I think that there has long been a lot of resentment and disillusionment between Athens Clarke County and the University of Georgia, given the fact that the University of Georgia is here and, of course, doesn't pay taxes. But I think that there are lots of really important contributions that are made by University of Georgia faculties and entities to improve Athens Clarke County community. And I think we can always do more of that work. I think we can always do a better job. I think it's more important now than ever, given the fact that, at the end of the day, Athens Clarke County and the University of Georgia, whether we like it or not, they're symbiotic, right? We can't really have one without the other. I mean, and so that's, it really is incumbent upon us to really make sure that that relationship is a healthy one, is a thriving one, that one that's not, plagued by resentment or distrust. And it requires, I think, ongoing and constant stewardship, and especially given the reality right now of the return to campus with 40,000 students and this explosion of cases, that's not necessarily going to help that town-gown relationship. Right?
This is kind of the origin of my
Yeah.
question on this,
Yeah.
as it's not a person not explicitly involved with any of this, but thinking about it from the beginning, when the COVID outbreak began, was very obvious to me and everybody I was talking to that it's going to really impact the community.
Absolutely.
But I didn't see any of that. The only perspective on so-called management of COVID that I saw was from the campus perspective, and multiple
Sure.
emails and so forth and websites and so forth, where the city was never mentioned.
Yeah.
And so is that getting better? I mean, is that in terms of the interaction? We on campus, in fact, are not in the loop in many ways.
Yeah. Yeah. I can speak from my very limited perspective of just the College of Public Health being engaged pretty actively and frequently with Athens Clarke County local government. There's a local government epidemiology advisory board that has faculty from the College of Public Health that has met multiple times with the manager's office, with the mayor. And there have been times when the mayor has made specific requests about research expertise or, just general advice around policy, particular policy.
I guess, and you don't have to answer this if you don't want to, but the regularity with which you meet with the people who are making the policy on the UGA campus. I know that your dean is involved on one of those committees, and so I'm hoping that is at least a rich connection to. But I guess I'm kind of wondering how we ended up with this situation on our campus, given that there was public health expertise available.
Yeah.
I'm suspecting that it was kind of hard to get through to the USG, which had its own game plan.
I think that there have been many entry points and opportunities for public health expertise and for public health leadership, particularly our dean, with Dean Davis, to speak into what is needed from a population health and public health perspective at this point on campus. And, the advice can be given. I think there are lots and lots of factors at play here. I don't know. I really don't know at the end of the day. For example, one of the things that I've advocated for fiercely is for us to have our own in-house contact tracing team at the University of Georgia, to partner hand in hand with the Department of Public Health to complement what they are doing. It is actually a specific policy recommendation that has emerged from the White House Task Force on COVID-19. And we as a university thus far do not have our own contact tracing team in-house. And so, I don't know the why beyond that. I think that all that we can do, as a College of Public Health right now is really have the expertise, have the infrastructure ready, and to offer it and to consistently offer it, and to just hope that, that the powers that be will make decisions that will really use the resources that we have to combat the pandemic to the extent that we can.
Well, I know that the people who are doing the follow-up with the students who are going to have to move, this is the housing group over in Russell, are looking for volunteers, basically, to train, to manage the either local quarantining or the return to home where possible of the students who are and either have a positive diagnosis or who are frankly symptomatic.
Mm-hmm.
And when this query went out of, sort of sounded like doing contact tracing, and also sort of as an ombudsman to help the students get organized to get to the new residents. And it seemed like the sort of thing where they said explicitly that the folks in the housing department, the people are on the ground, and this includes like custodial folks, who are kind of being repurposed for this under the circumstances, but they run out of, they 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 need more people basically, and they look for volunteers that way. And that query sort of startled me.
Yeah.
And so it seemed like a place where this kind of thing could interface well. But thank you very much.
Yeah, absolutely, Ann.
Right, so we'll take one more question from the, oh, go ahead, Megan.
No, that's okay. Go ahead.
Anisha, do you want to do the next question in the chat?
Yeah, so we have another question asking, can Dr. Adams comment on the presence of COVID hotspots, such as congregate housing, like senior buildings, jails, meat processing, and is the community leadership acknowledging these places?
Community leadership, what do you mean? Like Athens Clarke County, like local government leadership, or University of Georgia leadership?
I would assume the community leadership.
Yeah. Okay, so here's
Or Athens Clarke County, sorry.
Athens Clarke County. Okay, thank you, Dr. Miles. I do not know of data that are being collected on clusters or hotspots, and that's really problematic. I think that what we've seen, especially if you look at University of North Carolina, Chapel Hill, when you look at the decision that they made to kind of use their off-ramp and move undergraduate instruction online, that was largely driven by a series of clusters that happened in the very first week of the return to campus. And, you know, right now, the University of Georgia is relying completely on dog check and the self-reporting of positive tests. And then the Department of Public Health is conducting the case investigation and contact tracing, which is the follow-up after a positive test is confirmed. And so the Department of Public Health and their epidemiologists may have the data internal to District 10 about clusters or hotspots, but those are not data that I know of that the University of Georgia is collecting or analyzing. And I don't know if there's any collaboration between DPH and the University of Georgia to discuss those clusters or hotspots. I find that to be problematic and concerning. I think it's really important for us to know as a community. You know, the reason that I invested in Athens Wellbeing Project and really believe in it is because what we're trying to do is to create meaningful information to inform policy, and then to make all of that information publicly available and transparent. So I'm a big proponent and advocate. That's my bias. I'm a big proponent of data transparency. I think we should be sharing information, not just within the university, but with the community. And I don't have enough information to answer your question. I actually don't think that the University of Georgia is tracking those hotspots. Again, I think if anybody is, it would be the Department of Public Health. I would hope that they would, but there hasn't been anything that I've seen that's been published specifically about that. And I do think that that is a significant problem.
Building off of your comment on transparency, Dr. Adams, we'll move to this question on the screen, which is, what is the reason behind the lack of data transparency within UGA when compared to other Georgia colleges like Georgia Tech? How has Georgia Tech been able to test 30,000 people since the beginning of the semester, while UGA has tested around 3,000 for surveillance?
Lindsay coming in hot with all the good questions today. Yeah, so that's a big question mark. I mean, I don't know. I think that it's really important for us to look at the policy, to look at the organizational structure of how decisions have been made from the beginning with this. It was clear that the decision to return to campus, specifically for in-person instruction, was made at the University System of Georgia level, at the state level, right? Beyond that, it's really been that the University System of Georgia institutions themselves, individual institutions like UGA, Georgia Tech, Georgia Southern, they have a lot of autonomy in determining sort of how they test and do all the other things that they might do to mitigate or control the pandemic. One of the only regulations we have that has been at the state level implemented, of course, is that of face coverings, which was a very controversial thing and took a long time to kind of pass. Finally, we said, okay, when USG institutions return to campus, you're going to have face coverings. Thank goodness. But this is a really good question, Lindsay. I don't know. This is something that frustrates me significantly, because if Georgia Tech is doing this, we can do this. We are the state flagship institution. We should be doing this. We're not just getting shown up in the area of testing. We're getting shown up in the area of testing, tracing, and data transparency, which is why I co-wrote an op-ed with Amanda Abraham, David Bradford, and Adam Chin that was published in the Atlanta Journal-Constitution last month, probably much to the university's chagrin. You know, I think it's really, really important for us to recognize the fact that we are behind, and we should not be behind because we have the resources to do what we need to do here. I want the university to thrive and to be able to be open too. And I agree with you. We need to be more transparent. The university has consistently cited HIPAA and FERPA, but the way that the data are being reported at Georgia Tech do not violate either HIPAA or FERPA. It does not disclose any private health information, but it does give much better quality information on a day-to-day basis about where the university is in regards to cases in the pandemic. And that's just not something that we have. We have weekly data reporting from the University Health Center in the aggregate, completely relying on self-selection and self-reporting. It is completely inadequate, and it's embarrassing to me that we are behind, and it really should not be the case.
Thank you.
Welcome. Any other questions?
I'd like to ask, and I think it's probably a good follow-up to what you were just saying. The president's office responded to an email yesterday. Somebody who lives and works in Athens had asked about the dashboard and how and why it was set up as it is. And one of the things that the president's office said was that their medical experts had recommended the weekly reporting model. And as somebody who has paid very close attention to the daily reporting from the Department of Public Health, I'm just really curious why weekly reporting would be recommended over daily reporting. Can you speak to that at all?
Absolutely, Meg. I think you and I know, you and I've worked closely on the data analysis, especially, gosh, in the first 12 weeks of the pandemic. You know, you daily collected those data, and one of the things that we talked about early was the importance of looking at 5 and 7 day moving averages of cases relative to just looking at the raw new case counts every single day. And the reason that you do that is because from a data perspective, there certainly can be data that, you know, taking the mean over a certain number of days smooths out some of those outlier days. So for example, when we have a holiday, when the labs kind of slow down like Labor Day, or if we have a really off the charts day, taking that 7 day average can really kind of smooth things out and allow us to see what the time trend is looking like more accurately. But I don't confuse weekly reporting, right, with the way that we might calculate the data and present them with data presentation. I think that the daily reporting is necessary. You know, I think if we want to then analyze and present the data both on a daily basis and then kind of present 3, 5, 7 day moving averages, that might help us to see what the time trend looks like. But from a data standpoint, no, it makes a lot more sense for us to have daily reporting because, again, I worry about the time lag, and the university right now is not reporting the cases on a weekend, which it's not like COVID stops moving and infecting people on a weekend. I mean, that's ludicrous. So I don't agree with that decision. I don't understand that decision. I understand that there are sometimes capacity issues in terms of, you know, aggregating and getting the daily count and updating the website daily. Like that is the only logistical thing to me that requires the kinds of human resources that you have to say, okay, do we have the resources for this? But again, we're a huge institution. We should have the resources to be able to do that. I do think it's important for us once we have daily data, as I said, to kind of present those with moving averages because it helps us have a better idea about, you know, where we actually are so that one particular bad or good day doesn't skew us. Does that answer your question?
Yes, thank you.
Mm-hmm. Next.
I do see another question in the chat. So
Dr.
if you were to suggest 2 or 3 actions that we can take to improve our community right now, what would they be?
That's a good question, Dr. Miles. I mean, I think that we all have to be, you know, at this juncture, I feel like from the beginning of the pandemic that we have been plagued with this kick the can. So the national government's kicked it down to state level, state government kicked it down to local government, and now even within the local government, we have this insane division, especially in college towns where we have the university and the local government to contend with. And then so it's just been this kick the can down to literally the individual and family level, I think, to where we all have to become public health stewards, not just for our own families, but for our loved ones and whatever locus of control that you have. And I think, you know, if you're on this call, I think what you can do is the individual daily behavior things, of course, wearing your mask, washing your hands, limiting your exposure to large groups of people, those kinds of things that we all know to do. But I also just think it's time to engage in advocacy. I really do, and political participation. I don't really know what else to do at this juncture. I think if you have expertise, and you can, use your voice to inform policy, and even if you don't see the needle moving immediately, or if you don't see decision makers reacting to that, we've got to have a critical mass of organized people who are speaking expertise and speaking the evidence base into the decisions that are being made. And we've got to be doing that consistently. I think that, if I were in charge, what would I do right now to improve the relationship between the University of Georgia and Athens Clarke County? More transparency, more communication, sharing more openly the data, and discussing what we can do about it, trying to figure out how we can get more people tested quickly. But it's just a really difficult thing. It's hard not to feel overwhelmed, but Tony, I wish I had a better answer for you, but that's all I've got.
If anybody has any comments relating to that, feel free to unmute yourself and make them. If not, Anisha, will you share another question from the chat if there is one?
I'm not seeing any major ones. We do have one that was asked earlier that may have been answered, but maybe you could expand on it. It's more so about how students can possibly get involved with the Athens Wellbeing Project.
Well, Megan Bramlett is my doctoral student who works very close with me on AWP, so you can email her. And she has actually put her email up, I think, earlier, mbram@uga.edu. I love engaging with students and using the data. I think that it gives you a hands-on perspective on how data can be used to inform action. And we're always looking for students who want to get engaged. I also teach a health policy analysis class. Anisha, you're in there right now. And we typically do use Athens Wellbeing Project data in that class in terms of analyzing it and trying to feed it back to community partners who have specific data questions. We're going to continue doing that. Through the rest of 2020 and into 2021. We hope to go into the field in 2021. If you're a student that's still going to be at the University of Georgia in fall of 2021, then we're going to be recruiting heavily for students to do, hopefully, if it's safe, again, door-to-door data collection for the third round of Athens Wellbeing Project. So there are 3 ways that you can get involved.
Thank you for that, Dr. Adams. And then if there's no more questions in the chat, or if no one wants to make a comment, we'll move on through our Google form questions. I'll wait a few seconds to see if there's anybody that wants to.
Yeah, I have a comment regarding activism and advocacy. It's not a question, but I wanted to highlight the fact that there is an employees union, the university, United Campus Workers of Georgia, that has chapters at all of the major large size universities, including tech in the state. And they are very, very active in advocacy and activism and support too, I think, because there are many people who are eager to help out with, information. That's where I got this information, actually, on the need for volunteers in the housing department to relocate students. So there is a large body of very active people out there who are working on this, and it's United Campus Workers of Georgia, and you can Google it very easily.
Speaking on that, they do have an Instagram. It is UCWGA. I follow them. They have a lot of great information. So if you guys have Instagram, you can follow them on there. But there's a lot of student unions and student organizations that are advocating for students right now, as Dr. Summers said. All right. So we'll keep going through these questions in the Google form. Dr. Adams, from your experience and knowledge, will Athens go into a mandatory lockdown again? And what would be the deciding factor in this decision?
Yeah, absolutely not. So the Athens Clarke County has no jurisdiction over making that decision again. That shelter in place um, window of opportunity was really in March and March alone. Since then, the governor has used his executive authority and certainly has continued to extend the state of emergency, but has been explicitly saying that we are not going into a shelter in place. And if we did, I really don't know what it would take in the state of Georgia at this juncture, to be honest with you, to send us back into a statewide shelter in place. I certainly think that there are other states that might head in that direction, especially if we see the pandemic kick up exponentially again in flu season, but I don't see that happening for us. And Athens Clarke County, again, does not have the authority to make that decision.
Okay. Thank you for that answer.
Mm-hmm.
The next question, I'm aware that Athens received money from the CARES Act. Do you know how this money is being used and distributed?
That's a great question. It's being used in a lot of different ways. The most recent use of the emergency relief is actually dropped down on Tuesday, and it's an opportunity for small businesses in Athens Clarke County to apply for small business grants and loans. They have two separate tracks of funding, and you can apply for that through the Athens Clarke County government. The mayor and commission have made those funds available. They also are actually allocating significant portion of the CARES Act funding towards some efforts to reduce food insecurity, which is one of the biggest issues, one of the biggest fallouts from unemployment. And those are two specific areas. But yeah, just trying to, I think, really support some of these small businesses that have been put in jeopardy because of the pandemic, and to kind of keep them from closing. They've put this loan and grant program in place.
All right, thank you for that. Anisha, are there any more questions in the chat, or should I keep going through the Google form?
You can keep going through the Google form.
We got 4 minutes, Jessica.
Question already. Can you speak on how Piedmont, Athens Regional, and St. Mary's hospitals are handling the virus thus far?
Yeah, I can. I worked with a team of folks early in the pandemic in the first wave. Meg was on that team to estimate the cases that we might see in the first wave. Piedmont, Athens, and St. Mary's have done a really nice job communicating with each other and working with each other. I've been really pleased to see that. I think that's a really important relationship, and even though they're competitor hospitals, seeing them really work together and communicate has been really encouraging, really important. They've done a really nice job on that aspect. I think that the critical care has been strained. It's been strained for some time. If you look at the number of beds that have been available, which up until September 5th was produced in a daily report by the Georgia Emergency Management Association administration, you can see that we've had less than 10 beds available between the two hospitals for about 7 weeks since the summer wave hit. That's really concerning to me. I think that the physicians that I've talked to have been concerned about that. I've been in regular contact with one of the intensivist physicians at Piedmont Athens Regional. And so the big concern now, I think at this juncture, specific to Athens, is what's going to happen to hospitalizations, with the return to campus. Are we going to see another big wave there? Usually hospitalizations follow about 3 weeks after we see the big uptick in cases. And then the secondary concern, which is a concern shared by hospitals across the country, is what is going to happen in flu season, because typically in flu season we see, again, our hospitals fill up because that's, lots of people need respiratory support and critical care at that juncture. So I think they're worried about what's to come. Thus far, they've been okay with PPE. The one antiviral drug, remdesivir, that has shown some promise, they have been out of in intermittent phases and have had to ration it for really severely sick patients. But that's the only supply issue that I'm aware of at this juncture.
All right, thank you for that answer. And then that'll be our last question, as we only have a few minutes left. Thank you guys for attending. Our next panel is on the September 24th. It's Economic and Policy Evaluations of COVID-19. The recording of the panel will be posted on our Instagram. The first panel is on there already if you go in our link tree, and this one will be following shortly. Dr. Adams, thank you so much for your answers. And speaking of the flu shot, you guys can now get your flu shot. I went earlier this week to Publix. You get a $10 gift card. I'm sure the health center will also be doing it on campus as they usually do. I'm not totally sure because of all the stuff with COVID, but PHA will have a post about that soon too. But thank you guys for coming, and I hope to see you again at more of our panels.
Thank you, Jessica. And thank you, PHA.